Hey everyone. Well, this week we are celebrating the strength and the resilience of our communities all across New Mexico. And as many of you know, I am a New Mexican born and raised, and like so many of you out there, come from a family that often struggled to make ends meet. And so for me, my work is not just about serving our community as your congresswoman, but investing in the future of our state to ensure that our communities can thrive. And so today we want to talk about our work to invest in public safety, to address the addiction crisis, and to ensure that our people have every opportunity to thrive across the state. Since becoming your congresswoman, I have been fighting to bring home resources to address our fentanyl crisis and the addiction crisis across the state. We've brought home millions of dollars to build new behavioral health clinics here in Albuquerque. We are working in Sandoval County to help get funding for a new behavioral health and community center in Bernalillo. We're working with our tribes to invest in behavioral health clinics in the Indian Health Service and First Nations, in the International District. We're working with our law enforcement to ensure that they have smart technologies and the capabilities to crack down drugs being brought into our communities, and to ensure that they have the tools to fight crime and to make our communities safer. We've helped to bring millions home to build new fire stations and emergency response centers in the East Mountains and Moriarty, at Sandia Pueblo, serving both the Pueblo and Bernalillo County, and also down in Valencia County in the village of Peralta. Our work is rooted in the community. We are also fighting every day to address the healthcare crisis here in New Mexico. As somebody who grew up without health insurance, I know what it's like to not know how you're going to get your healthcare addressed. And that is part of why I was deep in the fight and 10 toes down, defending our communities against the big ugly bill and the healthcare cuts that we know will decimate our communities. We are working every day trying to get bipartisan legislation passed to invest in healthcare, behavioral health, to repeal the things that are harmful to our communities that have passed this Congress, and to make new investments in our communities and fight for a future where we have universal healthcare. These are our fights. These are the fights of our generation, and this is my work every single day as your congresswoman.